Do a number on your skin. Dr. Arthur Falk is a facial plastic surgeon from the Center for Plastic Surgery and Laser Skin Care here in Albany. Good to have you here this morning, doctor.
Thank you.
There is a new laser treatment program that is offered for folks. What is it called and how does it work?
What we're talking about is photodynamic therapy. It's a very unique way of treating precancerous skin lesions. These are things that can lead to real skin cancers. These are things that look like fine, scaly plaques on the face in high sun-exposed areas. And the treatment involves a combination of two elements. One is the application of a drug, which is followed by the application of a light which activates the drug and selectively destroys skin cancers or precancerous lesions. So it's a really nice combination treatment. We
have a photo that it's not the best shot. From here, we apologize for folks at home, but you can see the lesion right above the eyebrow here. How do you know if you're a candidate? Is it always as obvious as this?
It's not always that obvious. I think the big thing is that whenever you have a skin lesion on your face or body or other area that just does not go away after a period of several weeks, that's something that needs to be looked at a little bit further. These look really like very innocuous, benign, scaly little areas, and they flake, but they don't seem to go away. It's like a sunburn that never disappears.
So how long do you let it sit before you go to a doctor like yourself and say, I think I have a problem?
Well, certainly I think that it's reasonable to assume that if something doesn't disappear on its own within 3 or 4 weeks, that's sort of a good guideline at this point to think about that, particularly when we're in the sun a lot at this time of year.
Now, start to finish, how long does this treatment program take, or does it depend on the patient?
Well, it's interesting. I mean, we're talking about actinic keratosis or solar keratosis. These are precancerous lesions that lead to skin cancer, squamous cell carcinomas. There are several treatments for this. This treatment that we're talking about is one of the novel new treatments. It certainly abbreviates the course of treatment. An application of the drug is applied. This is followed by a waiting period of about 1 to 3 hours.
Okay.
Then the patient is exposed to a specific light source, and then the treatment really clears up in the period of about 3 to 4 days, as opposed to taking 2 weeks or sometimes prolonged months for some of these treatments to clear up.
What does something like this cost the patient?
Well, if it's indicated for a medical reason, this can be covered under general insurance. Typically, it's a little bit more expensive treatment than some. You're talking about a $600 treatment to start, and it usually goes up from there.
But if you're treating precancerous cells, if you have the money, it's certainly worth it to, prevent a long, painful road, thereafter. Right. Who are the most common patients that you're seeing? Is it men, women, young, old?
Well, it's generally people over the age of 40. Usually, if you're of fair skin complexion, you are more at risk for skin-related changes and skin cancers and precancerous lesions. So it's usually a fair-skinned individual who spends a fair amount of time in the sun.
Dr. Falk, thanks.